Proposition 61 was not passed last night. Valley View News reporter Ebony Hardiman has more on the California Drug Price Relief Act.
Proposition 61, or the California Drug Price Relief Act, was written to lower the prices state agencies pay for prescription drugs. It would keep the state from paying more for drugs than Veterans Affairs. Spokeswoman for the No on Prop 61 coalition, Kathy Fairbanks, says Proposition 61 may harm veterans.
Proposition 61 sounds great, but the question is whether it will actually work in the real world. And the 200 groups that are opposed to Proposition 61 worry that it will lead to increased drug costs in California, it will lead to decreased access to medicine, and it will harm veterans.
Not all were opposed to the measure. Registered nurse and veteran Kristen Del Marti says 61 sent an important message to pharmaceutical companies.
That they cannot make billions of dollars in profits while my patients cannot afford to pay for their life-saving medications.
We are going to have to take on enormously powerful forces who think that the function of healthcare is to make billions in profit.
Supporters like Vermont Senator Bernie Sanders says it's time to stand up against pharmaceutical companies, while opponents of Prop 61 worried how well the measure would hold up when put into practice.
They're very long on promises, trust us, it's going to work. But the independent experts who've looked at Proposition 61, who've actually evaluated it and looked at it closely, have come to a different conclusion and have raised a lot of red flags.
Proposition 61 has been sponsored by the AIDS Healthcare Foundation and endorsed by the California Nurses Association and the American Association of Retired Persons. Those against the prop include pharmaceutical companies and the Pharmaceutical Research and Manufacturers of America. Reporting from Northridge, Ebony Hardiman, Valley View News.